Our star doctor is here for the month of May.
Good
Okay,
afternoon.
ma.
Can you hear me?
Yes, I can.
Okay, good afternoon. How are you?
I'm fine.
Good afternoon, everyone.
Mhm. We are so happy to receive you. So we just like you to just tell us about yourself, a little information about yourself, and let's start the show.
Okay, good afternoon, everyone. So my name is Aderonke Edun. I'm a dermatologist. I did residency in the University College of Hospital. Right now, I'm a consultant physician and in-house dermatologist at Premier Specialty Medical Center in Lagos. I'm a Christian. What else? Yoruba, and I love my skin. Basically.
Your skin is very fresh. I want to know the secret of your fresh skin, and let's just start the show now. One of the questions we are going to ask you now, like, okay, is receding airline a medical condition or natural or hereditary? Like, what exactly causes receding airline? What's the cause for receding airline?
When you say receding hairline, we call that baldness in dermatology. There are different types of baldness. It could be a medical condition that is hereditary. That means it's passed down from family to the family members. Then it could be acquired. So I think for this discussion, we'll be talking about hereditary, which is the common one that is called baldness. The other ones, we'll probably talk about them later. This baldness is actually is a medical condition passed down. Usually, once somebody's parent, once they have it, it's likely that the children will have it too, especially if the father. So it's like passed down from the paternal side. So it's a medical
Okay.
condition. Yeah.
Okay, that's fine. Another question is that at what age can you begin to notice receding hairline?
Before we go to the age, I need to say that it's more common in men than women, but it occurs in both genders. Usually,
Okay,
it can be noticed immediately after puberty.
okay.
However, a lot of people will not notice until they are very close to 50, and much
Oh,
more later in women. But a lot of time it starts by just about after puberty.
okay. I just want to chip in this. If you have any question, you can just start writing your question at the comment section so that we can just go over it after the interview and all. Another question is, what are the early signs that one would have a receding airline? What are the early signs that you would see that, okay, these are the signs that, okay, probably I'm already having a receding.
Um, the medical term for baldness is androgenetic alopecia. It means
Okay,
hair loss due to the presence of androgens. So let's go
okay,
from that angle. If we go from that angle, we know that once there's hair loss, it's
okay,
likely to be a sign of baldness. However, in most
okay,
cases, when it starts at the beginning, what we'll
okay,
notice is that the hair, we'll call it hair density. Somebody that has full hair,
okay.
the African hair is usually very full. So what you notice is
Yeah.
that the hair becomes thin, is not as dense as it used to be. That's like the first sign that one will notice. Then subsequently, in some people, which is not all, it doesn't occur in everybody, there could be itching.
Okay.
There could be itching. You just find that your
Mm.
scalp is itching you, but there's no rash, there's nothing, but you have some level of itching. So that's another thing that can be noticed. Then other people, they notice what we call trichodynia. It means that there's a discomfort on the scalp. It feels like pain,
Okay.
but not pain. You cannot really say it's pain, but you just know that there is scalp discomfort. Those are the signs, those are the symptoms people can notice. However, a lot of people will not come to the hospital. A lot of people will not notice until they start noticing that the hair is moving towards the back. Those are the symptoms. There could be pain, there
Okay.
could be discomfort. Then the loss of hair is actually the ones that will make, oh, my hair is now going away. So that's those are most of the signs. And in some people, they don't have any symptoms at all until the hair loss is obvious.
Okay. Okay.
Yes.
Thank you so very much, doctor. Another question is that can you regrow receding hairline? Can it be regrow? Like, can you regrow it?
Okay, thank you for the question. That's a very tricky question because when we started, I
Okay.
said it's something that is usually passed in family. That means hereditary. That means the real cause is in your genetics. You cannot change your body.
Okay.
You cannot change the things God has, the things they call follow come. You can't change it. However, what can be done is that what
Can
can be
just
done is
maintain it.
that first of all, what can be done is that you can actually delay progression. Once you notice early, there are some things you can do. There are some medications you can
Okay.
do. There are some interventions that can be done, and also there can eventually, when the disease is now, when you now have the last stage, there can be hair transplants.
Okay.
There's no treatment, there's no cure, but it can be treated. But most of the treatment
Oh,
is directed towards reducing the level of progression, so that you don't get to have the hair without the scalp without any hair. Those are the modalities of treatment.
okay. The last question here is that can it be prevented? Are there any healthy diets or habits one can do to prevent receding hairline?
For receding hairline, prevention is almost not I don't even know how to say, but really it cannot prevent it. However, for healthy hair,
Okay.
we need healthy diets. Diet that is
Okay.
nutrient dense, zinc, biotin. I mean, just healthy diet, fruits and vegetable. That will help. It's going to help, even if you're going to have occur eventually in that person. It might be very late in the person's life. But prevention is almost there's no prevention. If you are going to have androgenetic alopecia, eventually it will occur. Yes, once the
Okay.
parents or once it runs in the family, balding hairline is likely to occur in that person.
Okay. Okay. Thank you very much, doctor. Before we go to the tips that you want to give us for glowing skin, I can see one question on the comment section. This question is, can we do hair transplants for those with natural baldness? Can we do hair transplants for those with natural baldness?
Okay. For the treatment of androgenetic alopecia, like I said earlier, there are drugs,
Okay.
there are interventions. So hair transplant is one of the
Okay.
interventions that can be done. That question is yes, and is available in
Okay.
Nigeria. So if you need to do it, go look for your dermatology and get referral. If you don't have in that center, it is available for whoever wants to do a transplant. So it's a yes
Oh,
answer. Yes.
okay. Okay. There would be a giveaway section, so you guys should just tune in. So just stay tuned. Just stay tuned. There will be a giveaway section, and that will be after the show. Just like Dr. Edun, please just tell us tips for glowing skin. Just tell us what we can do. Like I can see your skin is just glowing like this, and me too. I want a glowing skin. I want a glowing
Thank
skin like
you.
your own. Just tell us what we can do to get a glowing skin like your own. So the do's and don'ts of how to keep our skin glowing and shining.
Okay. For glowing skin, I don't like the term glowing skin because of this environment. Glowing skin is referred to as the fair skin, which is not true. So I rather say
Okay.
LD skin.
Okay,
So for
healthy
the
skin.
do's, LD skin, yes. So for the do's
Okay.
of LD skin, just like every other thing when you talk about your body, first of all, for skin, it is a cleansing and moisturizing is they are the two major steps that we need to get right.
Okay.
Cleansing basically means degreasing. So when we are talking about cleansing, that's how we bathe. It means just the simple word for cleansing is bathing in the general term. And when we want to
Okay.
look at how do we bathe and what we use, it is advised that sponging is discouraged. Use of sponge. The reason why use of sponge is discouraged is because it scrapes away the normal flora and the normal oil that are protective for our skin. Then also, when you talk about soap, antibiotic soap, antibacterial soap, hyperpigmentation soap, whatever soap is also discouraged. The kind of soap we need is a soap that would degrease, which means normal soap. We mean toilet soap, luxury soap. Yes, there are some cases that antibacterial soap can be prescribed, but they should be prescribed. That means they should be written by a doctor, and it's for certain dermatological cases. I know that growing up, we all know that if you don't scrub your body with sponge, if you don't use I don't want to start mentioning names of soaps now. I mean, you're not clean. So all those things are actually are discouraged. That's one. Then in terms of diet, fruits and vegetables are very good for the skin, especially the colorful ones, your tomatoes, your carrots, you know, they are very, very good for the skin. Then other things, exposure to sun should be limited. When you talk about healthy skin, exposure to the sun, yes, we need sun, maybe 30 to 1 hour per day, but in this environment, we cannot really measure the amount of ultraviolet rays we are getting from the sun because of our weather. However, the sun can also damage the skin. So exposure to sun should be limited. Our diet, we should clean with, if you have to use it, wash clothes rather than sponge. Then moisturizer, not, when you're talking about moisturizing, the idea of moisturizing is for you to hydrate the skin, keep the water level of the skin intact. All the creams you need to use, it has to be moisturizing, not hyperpigment, except you are treating a particular thing, in which other active ingredients are advised. So a moisturizer is a cream that helps to keep the skin hydrated. For skincare, moisturizing and cleansing, then your diet, avoidance of the sun as well. Then also, I want to say that when you are using a cream and you don't know what is inside, that's really discouraged. So if you're going to buy a moisturizer, look for a cream that they wrote, okay, in this cream we have oil. This is the name of the oil. We have this, not somebody makes something and tell you go and use it, and you don't even know what is in that cream. I mean, that's dangerous. So whatever cream you're buying as your body cream, the idea is for you to moisturize your skin depending on the type of skin you have. Then also you should know what is in that cream, because I know now we have so many manufacturers of skin creams. So I think it's high time. Okay. I'm looking at some of the questions.
Yes,
okay, we'll get to we'll get to the question. Okay, I'm noting that though. Okay. Basically, for your skin, you need to cleanse, you need to moisturize, you need to eat well, and stay away from the sun. Those 4 steps are advised. For healthy skin, not glowing skin. There's not like glowing skin in dermatology. What we know is healthy skin. Glowing skin is where people now had things. So wishy. That's when glowing skin comes. For in dermatology, it is healthy skin.
Skin, okay.
Yes.
That's noted. So we start calling it healthy skin now, not glowing skin. Okay. I think this person is asking question as regards receding hairline. This person said that, are there any intervention that can be done? I think this question should be for receding hairline. Probably the person joined late. I think you already talked about, but maybe you should just answer the question. The person
So I
joined
can
late.
just go over the question. So yeah, there are interventions that can be done for receding hairline. So it is important to know the signs and the symptoms early enough. When you start noticing the hair is getting thinner, the hair that is supposed to be dense, that is always full before, and it's now getting thin, you know that it's likely that you are having receding hairline. You are having hair loss that can cause receding hairline. If your father or your mother has this, you are likely to have that. If you have itching and there's no rash, and you cannot explain why your scalp is itching, these are things that can make you suspicious that you are having hair loss due to receding hairline. So what are you supposed to do? First of all, go to the hospital, consult your dermatologist. There are some drugs they will give you, there are some lotions, there are some ointment that can help to delay progression. In some cases, they might give you tablets. However, it depends on the stage of the hair loss. If it's some stage that you cannot really reverse or you cannot really delay progression, you can have what we call PRP, plasma-rich protein. Plasma-rich protein-rich plasma, in which they will take a part of your blood and infuse it and inject it on the scalp. Those can help with increasing of hair growth. And in some cases, at the extreme cases where there's really nothing, maybe all these things I've said earlier have been tried and then the result, there's no result, you can now have hair transplantation. And in some cases, you can actually do tattoo. Tattoo is a form of camouflage. So those are the things, so that intervention that can be done. But this has to be done by an expert. Okay, so once we notice anything that is strange, try and consult your a doctor or a dermatologist. Yes.
Okay, to buttress that point, if you need to speak to a dermatologist, here is Dr. Edu, Dr. Aderonke Edun. She's one of our dermatologists on the O Health app. Download our app, the O Health app. So you can download our app, online health company, O Health app. It's available on Google Play Store and iOS Store. Another question I can see here is that what happens to people who walk outdoors? I think this question should be for healthy skin. Like people who walk outdoors, what happens to them? When you said we should not allow
Okay,
sun to
for
touch
exposure
our
to,
skin too much.
yes.
Okay,
So
yes.
if work is mostly outdoors, it is advised that you use moisturizers that has moisturizer that have some protective factor. We call them SPF. A lot of moisturizers that are meant for the 15 and above. However, it is advised that 30 and above for the face, and then for the skin, if you get moisturizers with 15 and above is okay, because what they do is they screen off the ultraviolet rays. So as much as you are exposed to the sun, they serve as a layer that will prevent the contact of the sun with your skin. So if you have to walk outside, first of all, you can also wear protective clothing. Make sure your body is covered as much as possible. You can do those bowler hats if it's under the sun. Then also your moisturizers, try and get ones that has the ones that have some protective factor, and they are available. Yes, and I think they are also affordable. So
Okay.
those are
So
people
from
that.
okay, doctor. If you want to know about some other stuff on on healthy skin, so you can just chat our doctor hub on the O Health app. Another question is, what is advice for those using bleaching cream? What's your advice? Like, what advice do you have for them? Is
Okay,
bleaching
so
cream, is it good?
June 1 was actually the World Health Skin Day, and in Nigeria, our team was the scourge of to stop the scourge of bleaching. So
Wow.
what happens is bleaching is once you are bleaching your skin, usually the chemicals they use to bleach the skin, what it does is that it removes the topmost layers of the skin. And these topmost layers, they have a reason. There's a reason why God put them there. When you now remove this topmost layer, it means that their functions are not being done, which include protecting you from the effect of the sun, like we have said earlier. Because now you're exposed to the sun, it means that skin cancers can occur earlier. 2, it means that water is absorbed more than normal. You're losing more water than necessary. 3, it means that your skin is prone to infections that the skin is supposed to protect you from. I said earlier that we should not use sponge because on the skin, we have some organisms that we call normal flora. This normal flora, they are protective. So when you bleach your skin, you don't have a normal flora, you are losing water, you're exposed to the harsh effects of the environment. And also, we also know that the skin is the largest organ in the body. So when you now remove this largest organ, the internal organ that the skin is protecting, you're exposing them to damage. Can see the effect of bleaching on the skin is a lot. In fact, we can't finish talking about it. We can't finish talking about it. So it's not a good thing at all. And when the skin is now damaged by bleaching, the worst is to now repair is a journey of Honestly,
Of
it's
no hand.
difficult. Yes, the journey of no return. So it's better not to start at all. And the another thing is, people don't even talk about bleaching anymore. It's skin lightening, skin toning, skin glowing, skin this, skin that. So they are all bleaching. Anything that will change the color of your skin, it is bleaching. They are bleaching. So it is discouraged. That is why I said if you want to buy any moisturizer, any cream, look at what they wrote there. And thank God we have devices that will take you around. If you don't know what the ingredient, press it on the phone, check your internet. This ingredient, what does it do? What is it? Sometimes they write the steroids, the chemicals in names that are different, so that they will deceive the people that are buying, the buyers. Check the name, synonyms. Is it a steroid? Steroids are not meant to be used without prescription. You know, so when you buy products that have their names, the ingredients on the, you're able to know what you're using. And thank God we have, all of us, everybody has, we have these devices every day around us now. So I mean, we should be educated about the things we do to our skin. So bleaching is really, really discouraged. It's discouraged.
Okay, doctor. Another question is shea butter good for all skin types? Is shea butter, I think that's ori in Yoruba language. Is it good for all
Yes.
skin types?
So shea butter is a good moisturizer. First of all, let's start from there.
Okay,
Shea butter is a fantastic moisturizer. However,
okay,
the type of skin determines what you get when you use shea butter. Because we have about 4 types of skin. We have the oily skin, combination skin, sensitive skin, and dry skin. So it depends on the type of skin and what your skin's requirements are. So if you have dry skin,
okay,
shea butter might be good for you, but you still need other things that will help to repair the barrier. Do you understand? So there's no
yeah,
general statement whether shea butter is good for the skin. Shea butter is a good moisturizer, but you have to understand the kind of skin you have, which will determine what kind of moisturizer, or maybe you now use shea butter and something that has ceramide. Maybe you have to use something shea butter and something that has hyaluronic acid. So shea butter is a good moisturizer. Plain shea butter
okay.
that they have not
They're not mixed. Okay, that's
exactly. I don't
noted.
want not the hair. So that's
Okay,
it.
then
Yes.
that's noted. Okay, another question is what are the causes of skin peeling? Skin peeling.
Hmm. If I can, skin peeling. Skin peeling is English. So if your skin is peeling, there are so many causes that can be responsible. The first thing is if the skin is dry, it will peel. That's
Okay,
that's general. If your skin is dry, it will peel. So you have to take care of your skin. You cleanse and you moisturize. Make sure that the moisturizer you're using is the ideal one, is one that is good for your skin. The skin has very limited way of telling you it is, I'm not feeling fine. Is either it is dry, is either it is changing, but either it's black or white, then rashes. So if your skin is peeling, you cannot find a reason for that skin to be peeling. Your skin is not dry. You're trying as much as possible to keep your skin healthy. Please see your doctor. It could be a sign of a skin infection. It could be a sign of skin malignancy.
my question it's about organic products. I don't know, is it advisable to use like organic soap and organic cream? Like, is it advisable to use it on our body? That's my own question.
My answer is still um, depends on whoever wants to use it. But for me,
Okay,
I would say no. Except I know what
okay,
is in there. What did they mix together? What is the function? Is
okay,
this to moisturize soap? Is this to moisturize my skin? Is this to degrease my skin? If those are the functions, fine. But if I buy an organic product and I don't know what is inside, I I don't advise. They should tell me, okay, shea butter is 75%, vitamin C 2%, emulsifiers 1%, and they will tell me what are those active ingredients they are using. Then I will say yes. But if those are not there, I will say no. So there's no
okay.
fast rule about this. Yes, there's no or a yes answer to that question.
Okay. We're supposed to end by 3 p.m. What's the causes of itching after bathing? I think I can remember that question. The causes of itching
Okay.
after bathing. Yes.
Okay. Okay. So, itching after bathing can be caused by so many things.
Okay.
The commonest is if the water, we call that aquagenic pruritus. Is either the water is too
Okay.
acidic or is too alkaline. That's one of the most
Okay.
common causes of that. Then other things, in
Okay.
people that have allergy, it could
Okay.
cause that. Use of sponge as well can cause itching. Then also there are some other internal disorders, especially blood problems that could present as itching after bath. So
Okay.
if anyone experienced itching after bath and you have tried to look around you for what the cause, you cannot find it, please get to see a doctor. He could be telling a story of what is going on in the body.
Okay. Okay.
I guess there are no other questions, so any other person should direct the question to the how.
Yes.
Or what do you think?
That's
Okay.
better. Yes, ma. Yes, ma. So if you have any
Okay.
questions as regards receding airline or healthy skin, you can just chat any of our dermatologists on the O Health app, online health company. You can download it on Google Play Store and Apple Store.